you ready for it?
Take a look at our best sellers. This is always a hit. So is this.
Hey. Welcome to Sister Cole, Women Who Hustle Podcast. Right here, I have three special guests, healthcare providers, and also have my co-host, Miss Tina Bluford.
Hi, everyone. Welcome to our show. I'm going to introduce myself. I am Tina, the co-host and vice president of Sister Cole. Can you guys introduce yourselves?
My name is Dr. Artis Abdul Hakim Tawheed, a chiropractor who has been practicing for the last 40 years.
Wow.
I am Shamika Carter, NP, nurse practitioner. I've been a nurse for the last 3 decades, 30 years, and I've been practicing as a nurse practitioner for the last 8 years.
Mm-hmm.
Okay.
My name is Jamela Jones. I am a CNA, and I've been a CNA. I've been in the healthcare field for 29 years.
Oh,
Okay,
wow.
wow.
Well, welcome, gentlemen and ladies. Welcome so much. We are so grateful to have you guys here. It's such a pleasure. Just want to let everybody know about Sister Cole. Sister Cole been around for over 4 or 5 years. We welcome each one of you guys. Thank you for being a part of this podcast. Healthcare does belong to our heart. We all are a part of healthcare as well as
Yes.
Tina. She's also a CNA.
Mm-hmm.
And also we're a practitioner when we do body sculpture. So this is just a blessing to have you guys here.
Yes.
So thank you so much.
Thank you.
Okay. So let's get started. Oh my goodness, I got Dr. T on the platform. Just to let you guys know, I've been knowing Dr. T for over 10 years. Dr. T been such an awesome provider. Even when I come in and need some help with my backaches, he's there for me. So he's such a great provider. And it's just such a pleasure, Dr. T, to have you on the platform. I really do appreciate you. But let us know a little bit more about you, Dr. T.
Well, first off, thank you for having me.
Yes.
I was born in Vallejo, California, where I was primarily educated till 18, left Vallejo, came to Los Angeles, went to chiropractic college in 1978, graduated in 1982. From there, it brought me into doing research. And that's what I like doing with chiropractic because of the fact that we adjust bones, we treat through the neuromusculoskeletal system. And let me explain how that works.
Yes.
When we were first created, when we were conceived, the first thing that's formed is the brain and the spinal cord, right?
Right.
Yes.
That brain and the spinal cord is more or less the communication system. It tells the muscle to be the muscle, the heart to be the heart, the brain to be the brain, right?
Yes.
But because it's located in the spine, there are bones or vertebrae that exit where they exit. Sometimes those bones can become misaligned, touch the bone, reduce the amount of energy or consciousness going to that particular group of cells, causing disease. If we can look at it like this, just to see how the power operates. If we go to a power station, right, that generates energy, it sends the energy through the telephone line. Telephone line sends it into the house to the circuit breaker.
Right.
Each circuit breaker is divided into different parts, just like the spine. So if you have a problem in one part of the house, it'll cause a certain switch to go off. So you go to that switch and you turn it on, and that reestablishes that room with the power station. It's the exact same thing that we do with chiropractic. We're trying to help the tissue cells and organs and structures to maintain direct contact with the brain that's producing this energy. If it is impeded in any way, you're going to have a malfunction. What impediments look like, it's either too much nervous energy or not enough nervous energy.
Right.
So we make the adjustment. And when we make the adjustment, it's not that the doctor himself is directing anything. We're just removing interference. It's the intelligence that's within that created you in the first place, knows what to do once we get interference out of the way.
Oh, okay.
So what I'm hearing from you, Dr. T, is basically our body can heal.
Yes, it has the natural ability by its own creation.
Okay.
That's one thing that we can look at our bodies and be proud about because it never disobeys. It's always in response. Always in response to
Mika's
something.
nodding her head.
So it's like when we drink coffee, right? People say coffee's a stimulant. No, it's not a stimulant. It's your body's reaction to coffee
Right.
that causes things to increase or decrease. What I really like about the profession is the fact that it's the only profession that's really a specialty in everything. Because the nervous system's attached to everything.
Wow.
Yes. Yes.
It's attached.
Wow.
So, and that's the problem that medicine and we have always had. And it's not necessarily medicine, but the pharmaceuticals, because of the fact that they have different specialties. But there's a specialty for the eye, ear, nose, and throat coming from the nervous system. There's a specialty for the gastrointestinal system coming from the nervous system. So what we do is go and try to see what's blocking. If there's a problem, if there's a malfunction, the first thing you have to look to see, this God-given power that you already have, is it flowing naturally?
Wow.
I have nothing against medicine, acupuncture. I'm just saying if God gave me this, then I should be able to use it.
Right.
Wow.
Right.
So what I'm hearing from you, Dr. T, is more of like a natural reaction, right?
Yes.
Is I'm hearing this correctly? Natural
Right.
reaction.
Well,
Wow.
it's natural in this sense. Everything that's in creation functions the same way.
Okay.
Everything in creation manifests the same power, just a different form with a different expression. If you look at the sunflower, right? On the east, it starts to rise and it sets in the west.
Yes.
Why? Because that sunflower never goes against the instructions of its instructor. It's always being an obedient to the instructor. Well, it's the same thing with you and I.
Right.
If we want health, it's not about taking pills and other substances, because healing naturally starts from the inside out. Inside out.
Inside out.
Yes. The way the society is structured, that they want us to heal from the outside in, which is nothing. If that's the only way you have, let's do it that way.
Right.
But the point is, that's the way God set that up. So how do we are able to elicit this natural response? I always tell patients this: obedience to the guidance of God, that's your primary health care.
Amen to that.
That's it. Why? Because if you are being an obedient and following the natural law, the body naturally has to obey you. It's not that it's obeying you, you're becoming one with it.
Right.
Right.
Right? So you're not running into any type of interference there, right?
Yes.
So as a result, whatever the condition is, the body's always trying to resolve it. You don't need the special doctor to come and do anything.
Right.
It's going to start doing it on its own. And that's the beauty that we all have. That power is equal in all, has the same function in everybody, the same way.
Dr. T, I'm glad you brought this up, because it takes me back to we have a loved one, and this is Jamila's niece. Her name is Nai.
Right.
And I remember calling you. Nai was in a hospital. I'm going to let Jamila speak more about it as well as her niece. She was in a hospital, and she was in a serious condition.
Right.
And she was told she was diagnosed with leukemia.
Right.
And I remember calling you saying that, Dr. T, do you know anyone that can assist? You said, wait a minute, the body is natural. I need to speak to her. I need to talk to this young girl. I need to talk to her mother. And I remember how serious you was, and you were so dedicated to take your time out to talk to my cousin daughter, Dr. T. And I'm going to let Jamila speak a little bit on it, but I just want to say this to you. To have a great friend like you, a great doctor like you, that took the time out to pray over her. You set up prayers for us, spiritual prayers. We was on a time clock. We had to make sure we all pray in silence at certain times. That was such a blessing. And just to let you know, she is discharged home now.
It's good.
So I'm going to let Jamila speak a little bit about it. And then I know Jamila want to speak to you about it. And then I'll get back to the next question.
Okay.
I wanted to give your flowers to you, Dr. T. I thank you so much. We continued that prayer. It was every night at 9:00. We did a silent prayer. We was told that she wasn't able to fly from Oklahoma to California because of elevation in a plane due to her body
Right.
being affected with the leukemia. She had acute myeloid leukemia, which is aggressive.
Yes.
We kept getting bad, news because of the meetings that we had, and they were saying that it's a possibility she wasn't going to make it. Through prayers, through our Heavenly Father, she's here with us.
Beautiful.
She was able to fly from Oklahoma to California.
Mm-hmm.
She was in the hospital for a couple more months. The infection decreased tremendously. She's on dialysis. She definitely, the leukemia, she completed her last chemo a couple of weeks ago. She is in remission, and she's definitely talking to us. She's comprehending very well. She's doing good. She's doing good. So through your prayer and the dedication that you provided to us, we greatly appreciate that.
Thank you.
From our family to yours, we appreciate
thank you
that.
so much.
And that was the surprise to give your testimony, give her testimony,
Yes.
and also to share with you that the lady that you were speaking to, her sister is here, which is Jamila.
Yes.
You was talking to Precious, and Precious' daughter name is Nai. We call her Nai. And how you called me up. Dr. T called me up, I want to say, sis, maybe like a month ago. He said, wait a minute, I haven't heard from you. It's been a couple of weeks. How's the girl doing? I need to talk to her. Are we back on prayers? And just to know that you have a friend, a doctor that cares. And when you said the body heals itself, the miracle work. And we just thank God. And I thank you for that. So I definitely want to just give you your flowers as well.
But let me just say this
Yes.
about that. You're giving me too much credit.
Okay.
I'm not.
I know,
You're just giving me too much.
Right.
The reason being is this: my job is to release the healer.
Yes.
That's all I was doing.
Yes.
Is manipulating. I don't like to use the word manipulate, but we're making adjustments in her skeletal system, in her spirit,
Yes.
in her soul.
Yes.
It did it,
Yes.
right?
Yes.
So the credit is with God.
Amen.
You can consider me an assistant.
Right.
I'm gonna give cheers to that, Dr. T.
Yes.
I appreciate that. I appreciate that. So, Dr. T, my question is, what techniques do you use during chiro adjustments, and how do you determine which one is right for a patient?
Okay, good question. I'll answer the last part like this. What's right for the patient is what the patient determines what's right for itself. You make that call.
Right.
I don't. Again,
That's a good one. Yeah, that was a good one.
I'm just the guy who just come and, I'm just the guy, the plumber who unplugs.
Right.
I just remove the clog and everything just flows the way it's supposed to. That's all I am. But it takes a lot, because the way in which the body responds, it responds according to the level of the healing ability and what the doctor has healed within himself. Because you can't take a person any further than you are.
Right.
And that's real. I can't be back in the old days smoking weed, drinking alcohol, and trying to heal somebody. I got to first heal myself, right?
Right. Yes. Right. Exactly.
I mean, I thought that, but as you go, you learn that if you want to help others, you got to help yourself.
Yes.
In every degree that you help yourself, that's the degree at which you can help other individuals.
I agree with
like
that. I
that.
agree with that.
Yes.
I really do. I agree with that. You have to help yourself in order to heal.
Others.
And
Exactly.
help others, yeah.
I agree too.
Yes. Now, the technique.
Yes. Thank you.
I've developed over the years. When I first got into chiropractic, my whole perspective was this. Coming out of the 60s with my brothers, my cousins, they never allowed anybody to tell them they couldn't do anything. So I acquired the same thing, that same attitude. So when I was introduced to chiropractic, the first thing I thought was, how can I take this further? Where can I emerge out of this, right?
Right.
Well, it took about maybe 10 years. I was working with a patient, and I was in school, as a matter of fact. One of my instructors came in and says, man, it's not the wires, meaning it's not the nerves.
Right.
What are you talking about, man? It ain't the wires, man. You think it's the wires. It's not that. And so we sat down and we talked, and he told me it's the intelligence that's doing all that. See, the intelligence is the form behind the form.
That's deep.
That's what's doing all the manipulations.
Right.
So when he told me that, I'm a little space cadet. And I said, hey, where I learned is that? He took me to a guy named Dr. Van Rump, this European who lived in Santa Barbara. He taught me. He took me under his wing, you know what I'm saying, as an understudy. And he showed me that you can diagnose the body without technology. You just ask the body.
Right.
It tells you anything you want. You don't have to use muscle testing.
Right.
Although you can.
Right.
There's many things that you can use. I just prefer using command.
And
I
how would
just
you use that, Doctor?
Well, the thing is this. Again, I have to be in the right state.
Right.
I don't have to go in no seance and no trances, none of that stuff. I just have to have a clear head and a clear mind, and follow the protocol of healing, which is when a person comes to you, you have to be in rapport, right? I'm the objective mind. That person is a subjective mind,
Right.
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 Yes.
So
Right.
when I have the patient in the room, they're on the table, I analyze them, and I see what I'm going to do. I form that concept in my head. While it's formed, the atoms in my own brain is vibrating.
Okay.
And it sends that message to the person who's to be treated, right?
Right.
Yes.
Once that person get that idea, they act what I want to do out before I touch them. That's how I operate.
Signals.
But that's how we work. That's how we all work.
Right.
So the way that I do it is just I'm asking, is this out or that out? And I tell the body, make your own corrections. And it does.
Right.
Right.
Makes it real easy for me.
The power of signals.
But it's this. It is power of signals. But a molecule of something is the smallest part of the thing, right?
Yes.
But it's still 100% that thing.
Right.
You know that?
Right.
A molecule of the Pacific Ocean is the Pacific Ocean multiplied a gazillion times.
Right.
There is number one soul. You and I are just a molecule of it.
Right.
Right?
Right.
We're just a
Right.
molecule
I like
of the
that
one
one.
thing. Right? So since we're just a molecule of that, what you do to you, it can be done to all. You don't have to worry about working on one person. You can work on the entire human population if you have the idea and have the faith that can occur. You ain't doing it anyway.
Right.
Right.
Right?
That's true.
You're not doing
That's
it.
true.
So I've learned that I can help myself, which is true. But I also learned that if I desire to help many, God has to give me more. Right?
Right.
You got to give me more.
Yes.
Yes.
So when I'm going to sit and worry about trying to just help me, and
Right.
when I understood that, I said, wow, let me help the whole world.
Yeah. Why not?
Right. And so I was able to do that. And so what I'm doing right now in my therapy is treating people wherever they are. It doesn't matter where you are. I'm treating people in Fiji Island, Australia, right? Saudi Arabia, using this particular technique.
Right.
Not violating their rights. I'm not imposing my will on them.
Yes.
I'm asking,
Yes.
this is what you need, do what you do.
Wow. That is powerful, Dr. T. I do want to ask I have a few more questions. How can Chiro care help with symptoms or conditions?
That's, it's interesting. That's in our scope of practice.
Okay.
It says a duly licensed chiropractor can treat any condition, any disease, as long as it's related to the spine.
Okay. Okay.
Whoa.
Yeah.
I think I want to go into that, Professor. I think I want to change.
But check this out. I was at a seminar about last year, and this attorney had that on the board.
Wow.
Right? And I saw that and almost fell out my chair. You mean you're not going to treat everything else? Because I was very cautious. Now, gloves off. I'm coming after everything.
Coming in, huh?
I'm coming after
No stopping. No stopping.
because chiropractic before the invention of drugs was the primary healthcare physician, along with the midwives.
Right.
We was running things.
Yeah.
Wow.
But once drugs came in, they realized that they can make drugs out of petroleum. It took us out the box. They did. So what they did, they went through the Congress and had a law that was
Right.
passed to make drug therapy the standard of care. It
That's true.
made me an alternative.
Right.
I was going to say that too. I prefer natural healing. I don't do drugs and medication.
Right.
You know, I do the herbs,
Yeah.
but I'm not a big fan of medication.
Sure.
You know, because I don't want to be addicted. Because I feel they say that once you take one medication, it impacts something else in your body.
True.
It does.
So, and I know medication is good for some patients. I know they have to rely on it, but I prefer not to take too much medication.
But again, if you are in alignment with the spirit that's within you,
Right.
if you obey the good in you,
Yes.
look what you have going for you.
Yes.
What mama's got. Baby starts crying, acting crazy. She grabs him, left hand, pats him with the right hand.
Right.
Well, she's bringing the whole universe, everything in the universe there to help that child.
right.
She ain't aware of it, but she just being mama. But
Right.
that's what she has going on. So if you stay obedient to that law, to the law of yourself, you have the exact same thing working for you
Yes.
all the time.
Okay.
Okay.
My next question, Dr. T, is what is the scope of Cairo?
Okay. Scope of that's treat anything.
Okay.
And that's true because the nervous system is attached to all the tissue, cells, organs, and structures of the body.
Okay. That's true.
So wherever there's an interference, something is impeding that flow, my job is to go and find out where it is. Remove that. Now the energy flows because it just does, right? It's going to do what it's supposed to. I don't have to suggest anything to it.
Right.
Because if I do, I'm imposing my will on it.
Right.
When it knows how to do it by itself, that's how God hooked it up.
The flow.
That's right. Let it do what it do.
Okay. Okay. Removing that blockage. Like you
Blockage.
said.
Yeah, removing blockage.
Removing blockage. Okay.
I like that.
I like that too.
Yeah.
Well, sis, you have a question for Dr. T?
Let me
'Cause I'm
see. Let me see.
I'm gonna just keep going on and on. It's like it's getting very interesting for me.
Sure. Okay, I'm gonna go with this question here. What challenge did you face in the beginning, and how did you overcome them?
In terms of professionally,
Yes.
let's see. It's not a difficult question because I tell everybody, my life has been a storybook.
Right.
When I decided that this is what I wanted to do when I was 20, and I wanted to see how, and that's the question, how can I help humanity with this? Everything fell into place.
Right.
I mean, I tell my wife all the time, there was no struggle,
Right. Right.
right? Y'all tax dollars sent me to school.
Right.
I graduate. I get out of school. I'm married. I have a newborn, and I'm down at aerospace at the time, which was popping, trying to get a job. They told me no, I couldn't even pick up no trash. And you're overqualified. So I called a chiropractic college, and I asked them, were there any doctors looking for a student doctor? Oh, it says yes. One just hung up. He's in Hawthorne. Called him up, told me to come in. I put on my Sunday go to meetings. I went and had a meeting with him. He hired me right on the spot.
Oh, good.
Wow.
And what's beautiful about it, I've been there ever since 1982.
Wow, really?
It's a long time.
Wow.
Yeah,
Dr.
that's a long
T.
time.
So, with that,
Wow.
I was being great, getting paid well, and somehow he wanted to sell the practice. He had several people coming in. They just couldn't afford what he was asking. So one day he says, would you like to buy into the practice? I said, yeah. He says, we'll do it 50-50. No, he says, we'll do it 51-49. I said, no.
You like, no, that ain't gonna work.
That ain't working.
I need my money.
We going 50-50 on this one.
Exactly. I don't
And
blame
with-
you either.
In that, we incorporated and it allowed me to do everything I want to do.
Oh, wow. That's
Everything that I
amazing.
want to say.
That's
so
amazing.
it just wasn't, I don't have that kind of story to tell. It wasn't hard at all.
Well, good. That's good. That's real good.
So at this time, we're going to go ahead and take a quick break. So we're going to take a break and we'll come back and introduce Shamika.
Shamika.
Yeah, Shamika. So break time for
So
us.
break time for us.
Okay.
Are you ready for it?
Take a look at our best sellers. This is always a hit. So is this.
I see the crystal raindrops fall, and the beauty of it all is when the sun comes shining through. I see the crystal raindrops fall, and the beauty of it all is when the sun comes shining through.
Welcome back.
Yes, welcome back, everyone. Okay, we're going to be asking questions with Shamika. Now, I see you said you were a veteran of 28 years, and you're the founder of True Care Telehealth Medical Group. Okay, my question is for you. What inspired you to start your entrepreneur business or journey?
So I got hit with the entrepreneur bug when in 2004. 2004, I started a nonprofit organization called Safe Care and Resource Center for the Elderly. I've been in healthcare, like I said, for 28 years, but let's say 30 years because I was a CNA for 2 years and then a licensed nurse for 10 years and then RN. So all of that. I started off in long-term care, working in nursing homes. And I saw a lot of people, you know, they would fall at home or have a stroke, something like that, and they go to a nursing home, and that would be the end of their life. They'll never be able to go home again. And I didn't like that because I was like, oh my God, that could be my future or anyone else's future. We're all, you know, working class people. We work hard for what we have. We don't want to lose it in our golden years and have to spend it in nursing homes. So I started this organization called Safe Care and Resource Center for the Elderly in 2004. And that was the beginning of my entrepreneurial journey.
Okay. The next question is, how did you you come up with the name and concept of your business?
So True Care and Safe Care comes from the same heart. I believe that for my entire career, I've given true safe care to individuals. I'm there, I'm present. Like the good doc said, the patient is the subject. I'm objective. I look at them and they tell me what's going on with them. I listen attentively, and just based on what they say, then I create plan of cares for them to make sure they get better. So.
Okay, because, you know, it's good to know, because sometimes you can have a practitioner and, you know, you have these patients where they go to their doctor and trying to explain to their doctor, you know, what's going on with their bodies or whatever, you know, everything and stuff. Sometimes you don't get that with certain doctors. You know, they tell you something else, well, it could be this. But sometimes it takes the time to listen to the patient and to understand what the patient's going through. So that's good that you listen to your patients, you know.
Yeah.
You don't find too many doctors that does that, you know.
Yeah. Actually, studies show you have 18 seconds once you sit down in the examination room to get out what's going on with you before the doctor stop you and tell you what's going on with you, just like you just said. You got 18 seconds.
Yeah.
studies show that.
Yeah, exactly,
Yeah.
exactly. Well, my next question is, what challenge did you face in the beginning, and how did you overcome them?
Challenges. One of my greatest challenges is getting paid.
I like that one.
I know how you get paid. Huh? It's always about the money.
Right, it's always about the money. Right. I'm an excellent, exceptional caregiver. I've been doing it for a long time. God has given me the grace to perfect what I do. I deserve to be paid for my art. I consider it art. So just getting paid from the insurance companies has been a challenge from beginning, even until now, and it's still a challenge. But this 2026 year, this first quarter, our goal is to break through those barriers and get our money.
Exactly. Yes.
Can I say something
Go
about
ahead.
that? Because I work for the insurance company. So if you need some assistance, let me know. Definitely, I worked with several doctors on their billing and appeals. And I know sometimes it can be hard to get paid. And you have to understand the rules and regulations and what is the timelines.
Right.
You know, if it's untimely, it's been denied. So definitely you need some assistance. I'm here for you.
Thank you. I appreciate that.
Yes. Okay. Next question is, did I use that question already? Okay. What's one moment in your journey that made you realize, yes, this is my purpose?
Okay. So 1997, and I know that's a long time ago. It's the 90s. In 1997, I was working in a nursing facility, and I was a wound care nurse. We had a patient that was very aggressive, throwing, fighting, doing what they do when they lose everything and they're institutionalized for the rest of their life. She was just aggressive. She hated the world. And everyone that would go in there, she would fight them. She had a diabetic ulcer on her foot. And I was the wound care nurse, and she would refuse care. So if you refuse care, then I respect that. I'll just go to the next person. But this one particular day, she let me come in. I didn't know whether she was letting me come in to beat me up. I didn't know what was going to happen. I didn't know what was going to happen, but I was like, Lord, be with me. So I went in, and I knelt down, got on my knees, and I told her, I'm going to dress your sore. I'm not going to hurt you. If it hurts, tell me, because I can't feel it.
Yeah.
And she said, okay. She didn't say nothing. She just was looking at me with like this growl on her face. And
Ready to attack.
Ready to attack, girl. And I started on her pressure sore, and I was taking off the dressing. And as I got it off and I'm rubbing it, I'm cleaning it, she said, you sweet. And I was like, I looked up at her like, okay. But that moment confirmed what my grandma has told me since I can remember 5 years old. My grandma has been telling me that I was sweet and that there's something about me that make people just want to love me.
Right.
So this angry, aggressive woman changing and saying that to me, even through the attitude, even through the it let me know that this is what I'm supposed to be doing.
Right. Makes you feel real good that you're doing something. You're just helping people. So yes, I get that because I'm the same way. It makes me feel like I'm doing my damn job. I'm doing my job.
Right.
I like that.
Right.
Okay. The next question is, how do you balance being a woman in business and owner and everything else in life brings?
Faith. God.
Yes.
My creator. I work through biblical principles. I was born into the faith. My grandma is an apostle. My mom is a woman of God. So, we're in this world. We're not of this world, but we're in this world. And throughout my entire journey, I've always put God first.
Yes.
And as a result, he takes care of me. Mind, body, and soul.
Right. That's right.
I love that. I love that. Mind, body, and soul.
Yeah. That's a good one.
That's a good one.
Yes. Well, I have one more question, but I'm gonna let Janita see. Does she want to ask you a question before I ask the last one? Go
Yes.
ahead,
Well, I just want to say I do know Shamika personally. I met Shamika through my auntie, which is me and Jamila's auntie. Shamika, I know you probably didn't discuss this, but she also does services where she comes to the house and give vitamin therapy treatment.
Yes.
Yes. So something I want to really get into. I think vitamins really important because it's important for the body. Can you just speak a little bit about that if you don't mind?
Yes. That's another one of my passions. One of my passions is diabetes management, all things diabetes, because genetically my family have a history of diabetes. So, but the next thing is, I believe, like the good doc said, our bodies heal itself from the inside out. And yes, some people get so far gone that they require the chemical medications. And I can't tell them not to take the chemicals.
Right.
However, before you get so far gone, then if you feed your cells what it needs, the vitamins, minerals, and amino acids, then it will respond positively and your body will do what it's supposed to do.
Right.
It'll heal itself. It can heal itself. This is a phenomenal piece of artwork created by a phenomenal creator. Yes. It heals itself. You just have to give it what it needs. You have to give it the foods that it needs. You have to give it the vitamins, minerals, and amino acids that it needs. You have to move it, all of those things. So vitamin infusion is a way to feed your cells directly. When you take vitamins by mouth, it has to go through the GI system, break down in the stomach, and then it gets to the cells, go and do what it needs to do. So you only get about 20 to 30% of the vitamin. When you give it via infusion, you get 100% of the vitamins because it's right in the vessel. The cells are just taking what it need, and whatever the cells don't need, you urinate it out. So it's not like you're being over medicated. Vitamins are not medication, but just, you know what I'm saying? You're not getting too much of the vitamins, minerals, because whatever you don't need, your body just automatically eliminated through urination. So yeah.
And I will say this too. She also go to your house. Like if you want this vitamin treatment, she'll schedule and come to your house.
Now, I was looking into that earlier on Google. So I'm glad you brought it up because I was looking on Google because I have a problem with dehydration. And I can drink, I'm not really a drinker of water, but I've been trying. So I've been using the powder IV, liquid IV into my water, and I still can't really drink it still. So I have a problem with dehydration. So I would think about doing like the therapy of the IV for dehydration and stuff, and vitamins.
Take you a bag, get you a bag. Yeah. And, but what can I ask you why? What's with water?
My body just don't allow me to keep drinking. You know, I hear people drink 8 bottles of water. I can barely get 2 in. Really? I stay on that same one all day.
Yeah.
I stay on it all day, and I won't drink nothing else throughout my day.
So a vitamin infusion of normal saline would be excellent for you.
And that's what I need.
Yeah.
I'm telling you, that's what I need because it's hard for me to drink. It's like I'm constantly, I eat more than I drink. I can eat dinner and finish that whole dinner and may take one sip and might not drink nothing. But I'm eating the food and I won't drink anything. It's just my body's not allowing me to drink. I just don't feel the urge of drinking.
Yeah.
And then it calls me for having dry skin. My mouth is dry right
That's
now.
what I'm thinking. What are the side effects of your body?
I lost a lot of weight.
Yeah. Well, that's
lost a lot of weight because I read over everything on Google. And I was like, why I'm losing so much weight. And then it tells you if you're dehydrating, you lose weight. Right. And then with my thyroids and the hormones mixed together, I'm losing a lot of weight, and then the dehydration. Because right now my mouth is dry. Right now my mouth is dry.
Right. So we're definitely going to schedule an appointment with you.
I definitely need one because I've been looking into it. I really have.
Absolutely.
Okay. Now, any more questions? Yeah, I do have another question.
No.
Okay. Let me go back to the okay. Now, my last question is, how do you use your platform or business to empower other women?
Girl, you know I like to talk.
Go ahead. That's what we're here
I
for.
educate. I use the platforms to educate, like the Facebook, the TikTok,
Yes.
the YouTube. I read a lot. I've always had an infatuation with books for a long, long time. The first book I ever read in my entire, chapter book was Roots, believe it or not, was Roots. It's a big, thick book. So I read, and when I get the information, I get excited and I want to tell everybody.
Right.
So that's what I do. So when you guys see me,
Yeah, which is a good thing.
When I see her on TikTok, I see her on Facebook, I said she on this platform.
She's providing information.
Yeah, it'd be
She's
good.
providing
Yes, good information.
I mean, information about the body, what to eat, how to work out. I mean, everything is just so informative, Shamika.
It is.
Thank you.
Yeah.
And we need that information,
Yes.
because a lot of people's not aware about their bodies and stuff like that, or what to do. So when you put it on the social media, I'm reading it.
Yes. Oh, yes.
That's what I do. I educate through social platforms. I educate through patient engagement. Just whoever will listen to me, I talk. I like to talk, so I'll talk to everybody.
I'm listening.
Yes, we are listening.
We listening. We are listening.
I will say this too. I mean, it was a juice that you spoke about. That juice was just looked so delicious.
Oh, yes.
The berry.
The berries.
Blueberry, basil, ginger.
Yes. We need that
Oh, my
recipe because
goodness.
I do juicing.
Yes.
I make my juice.
It
So
was
I need that
good.
recipe so I can.
We definitely need that juice out the
Yeah. I need the
Pretty
recipe,
good.
what I'm supposed to do, so I can go get it and make my juice. And then I'll
Right.
call you over and come get
Call
some.
me over.
Give you a bottle.
I'm going to take a sip of it. I just can't put no alcohol in it.
Girl, that's not what we're gonna do.
I know. Okay.
We're trying to be healthy.
Yes, I
right.
agree.
I
I agree. I forgot we have Dr. T and Shamika. and Jamaica.
Yes.
We got health care, so let's not talk about alcohol. Okay,
Yes.
I got it.
Okay, Shamika. Thank you for being here on the show. We enjoy all the the answers that you gave us. It was very knowledge. So we're gonna go to the next person, Jamila.
Yes. Miss Jamila, let us know about who you are besides being my cousin.
Well, I'm Jamila. I've been a CNA for 29 years. I've been in the healthcare. I enjoy being in the healthcare as well. And thank y'all for having me on your platform.
You're welcome.
And being with these two other guests, Dr. T and Shamika, learning more about this.
Yes.
But yes, I enjoy being a CNA as well, and to be able to help people to feel better, to be able to help them with their health as well. A lot of people come to the hospital to where they're sick and they already feeling bad already, but to be able to be there to help take care of them,
Yes.
it builds their confidence up
I agree
because they
with
have
that.
someone to care for them.
Yes. I agree.
And I'm currently working in a hospital, and I work with vets. So to be able to work with veterans and, in different concept of things, it makes me feel better. And to be in the healthcare makes me feel better. So they're just leading me to go to higher,
Right.
to do more things to help people feel better and to improve the healthcare that they need.
Yes. I agree.
So my next question is, what do you plan to do? Are you planning to stay in healthcare? I have a change of goals. What is your plans?
I am planning to stay in healthcare.
Okay.
I am planning to, I am going back to school, and I'm going to go for the LVN program. And then after that, I'm going a little further. And I'll be doing something to have my own business to where I'll be going to different homes, provide home care to
Okay.
patients.
That sounds good. Okay, my question is for you, Jamila. Do you plan to stay in the healthcare field or change your career?
I'm planning to stay in the healthcare field.
Okay, good.
That's my passion.
Yes.
I love people, and I love to help people as well.
Yes.
So
Same
to be
here
able
with me.
to provide the patients and love that they need, along with the care that they need as well, I would definitely stand it.
Yes, I agree with that too.
My question is, what advice would you give someone? Like a healthcare advice.
I would tell them not to give up,
Okay.
to keep going. Whatever obstacle that come in their life, just keep going. God has provided us to fight our battles. We have made it through the storm, so just keep going. Never, never give up.
Okay. Okay. What do you like about your job?
What I like about my job is I love people as well, as I said before, but to provide the care that they need.
Okay.
It makes me feel good when a patient see that, to leave out their room with a smile on their face.
That is so true.
To let them know that, they told me that, I see that you care.
Yes.
Yes.
I see that the care that you provide, that, you have the patience, you have the love, you have the comfort, because that's what they need.
And that's
I've been in there for a long time. I've been in the healthcare field for 29 years.
Wow.
So I have seen a lot.
That's good.
Yes.
I have learned a lot,
Yes.
just from doing patient care to wound changes, to IV flush, because I work privately as well with patients that were hospice patients.
Mm-hmm.
So having this skills in this healthcare field, it makes me feel so good. And like I said, I will stay in this healthcare field till I retire.
And I agree with you because, as for me, I've also been in healthcare for 24 years. At this time, right now, I am retired, but I'm going back into the field. I'm going back in the field because, as Jamila's just said, when you have a patient, and even when their family member is there and they see you taking care of their family very well, that means a lot to me. And then hear the patient, always say, I want this nurse right here. I want her. Even though I used to get that all the time when I'd be on my off days. And they get, when I'm not there, I come back on my, back to work. They was like, where were you? I said, I was off. I had to have my days off. They was like, well, this nurse that I had, I don't want her no more. I asked about you and they said you was off on your day. So that makes you feel real good. You have a patient that really wants you there and be their nurse and stuff like that. That makes you feel real good. So it's like, that made me feel like I'm doing my job.
Yes.
I'm doing what I'm supposed to do, which is me. My thing always been helping people. And I always have that in my heart, because I grew up
That's
on
a
it.
beautiful thing. I do want to speak more about, with you, Jamila. I know that you did so many different settings at different departments or units. Can you speak more about that to us? Like the different units you worked in?
Well, I worked in med surg, I worked in ICU, I worked in PCU, I worked in OB, I worked in different units as stated. It plays a different part in your life because people have different illnesses.
Yes.
When I go to ICU, you have these patients in here with all kind of they monitors on them, IVs going through their bodies. They have a breathing machine to help them breathe.
Right.
When they go to PCU, they downgraded because they're getting better.
Right.
And all these take a different part of my thinking because I see what these people's going through different stages of their life.
Yes.
To go through med surg, I worked in med surg, and I see people coming back from surgery. I'm watching people get dialysis. Now it's touching me personally because I have a niece that's going through dialysis now.
Yes.
I can be an asset to my sister because I could better take care of my niece personally.
Yes.
So being in different units, you're learning different things because everybody condition is differently.
Yes. Yes. I agree with that.
Out of all the units you worked in, which one, I don't know if it's considered to be preferable. I mean, which one do you prefer? Or which one would be your least unit to work in versus, the opposite?
Good question. The most important one, well, all of them is important as you stated. The most important one is the ICU.
Okay.
You have people that are in intensive care. And by my niece being in intensive care, she went from intensive care to progressive care. Now she's at home. She went through 3 different stages of what I'm dealing with now as being a CNA working in a hospital with the patients that I work with now.
Okay.
So I would definitely ICU, and with the least, it's med surg because they are still able-bodied. They just got surgery done.
Got it. That makes a lot of sense. So having all of you wonderful healthcare providers, is this something that you will leave us with pertaining to healthcare. And I will start with you, Dr. T, and go to Shamika and Jamila. What would you leave people that's listening right now? What would be a word of encouragement or advice?
I would tell them that you're ultimately responsible for your own health. Not the doctor, not the preacher, not the imam. You are responsible. So this means that you have to do your due diligence. You have to use your mind. You have to do your research.
Right.
Because you have to be convicted that this is the thing that I need to do.
That's right.
Yes.
If you're not convicted, there will be no results.
Right.
Oftentimes we put on others what we should put on ourselves.
Yes.
Well, the doctor didn't do. So the therapist didn't do. No, you have responsibility. And that's what I tell my patients.
Yes.
That, you have to do this on you. They don't like it
Yes.
because they want me to do it. No, I got my own problems.
Right. And then you get
I'm just holding on.
yeah, you get people who don't do their regular checkups too. You have people like that don't do their regular checkup,
Right.
and then you have to because you don't never know what's going on with your body. It's something you can be going through something internal in your body, and you would never know because you don't do the regular checkup. So that's important.
Right.
Yes.
And I do my regular checkups all the time, and I tell Janita, if I feel something different in my body, I'm calling my doctor,
Yes.
Right.
It's
and I do
important.
that
Right.
Yes.
Right.
on a regular basis.
But just know that if you are one with yourself, your body's one with you.
Right.
I like
Yes.
that.
And that's what we got to know. You have to believe that
Yes.
and know that because everything that goes on, we don't understand stuff that's going on.
We don't.
I agree.
But if we obey, then we get the benefits of obedience. Do that.
Like
Okay.
that.
Okay.
Yes.
So let's move on to Shamika, nurse practitioner.
I agree with the doc. You're your best advocate.
Yes.
You can't be feeling sorry for yourself. You have to speak up for yourself. I agree with the lady. You have to get your preventative health done.
Yes.
It is utmost important. You got to get your labs drawn. Your labs is just a picture of what's going on the inside of your body. You
Yes.
can't see the inside of your body. So your lab work, that blood work tells you what's going on the inside of your body. Preventative care, those checkups are so absolutely important.
Yes, they
Once
are.
a year, just get it done because prevention is better than cure.
Yes.
And early detection save lives. And it's not just a cliche. It's
Right.
real.
Right. Next, I'm going to move over to Miss Jamila.
As Dr. T and Shamika said, they said some important things. Do not be your own physician. If you feel something is wrong, do not ignore it. Make sure you go to the doctor. I don't care if you have a headache and it's constantly going, go get it checked out. It might be something else.
Yes.
So
Yes.
make sure you check anything that's going on with your body. Just go get it checked out.
Yes. Agree. I totally agree on that.
So at this time, I want to just do a pause for a second. I want to call one of our administrator up here. Her name is Nikki. Actually, I do have a jacket to give Nikki. You know, we are Sister Code. Sister Code been around for 5 or 6 years. Nikki has been with Sister Code from day one. And I want to acknowledge this beautiful young lady for being a part of Sister Code for so long. I actually do have a jacket to present to Miss Nikki. If you are in the back, come on through. This is live. Let's give Miss
Yes,
Nikki her
give her a
jacket.
hand.
You put it on, Miss Nikki.
Congratulations.
So this jacket is Sister Code. In the front, you will see where it says Sister Code. And then also you will see
That's
it
her
has her
name.
name and the number 12.
Beautiful.
So Sister Code first jacket. And I had to present that to Miss Nikki because she has been around from day one. And I really do appreciate you, Nikki, for being around. And thank you so much for just being around Sister Code for the longest. Thank
Yes.
you.
Yes. Yes.
Let's
I agree.
thank you.
Thank you.
Thank you. So at this time, I want to also just speak about Sister Code before we close out. And I also want you guys to give out your social media information. Sister Code has been around. I am the founder of Sister Code. The reason why I created Sister Code is to really encourage women in the network. Being the only child for 16 years, not having a sibling, and been around my cousin for almost my whole life, I always wanted to bring a group of network of women together so we can empower one another. So Sister Code is all about empowerment, encouraging one another, and also to just walk by faith and not by sight. I am a true believer. I do believe in the word. I apply the word. And I also believe that we can help each other out. So for those people that's watching on our platform, I want to also give you guys kudos as well for being a part of Sister Code, because you guys make Sister Code. We cannot do this without the ladies.
Ladies, I agree. Yes.
So I appreciate you as well, Miss Tina,
Thank you.
for being a part of Sister Code as well, and Miss Jamila. And at this time, I'm going to let Tina speak about what she got going on with Blue Activewear. And then we're going to come back to our guests and let them let us know how people can get in contact with them on social media. But we're definitely going to bring these people back, right?
Yes, we're gonna have y'all back
Yes.
because we need to talk about more about healthcare. There's a lot of questions we still have for healthcare, so we definitely will have you back. So,
Yes. Before I let you speak, sorry, sis, I want to give a shout out to Audrey. She's our admin behind the scenes.
Yes,
so
behind
we
the
got to
scenes.
definitely get a shout out to Audrey.
Shout
so
out to
Audrey,
Audrey.
shout out to you. You know, Audrey has been around. She's been working behind the scenes. You guys received the email from Audrey, the communication from Audrey. So definitely want to give a shout out to our admin.
Yes, most definitely. She's been doing a great job, helping us out, and we appreciate it because it is a lot. Because we all have our own individual jobs and stuff and things that we do. So to have another third hand or a fourth hand, we appreciate that.
Yes.
We really do. So thank you, Audrey.
Yes. Okay, so can we know more about your platform or how people can get in contact with you, or if you want to provide any information, or they can comment, or they can probably contact me? Because I know healthcare is very private, so I guess best way is contact me. Okay.
You can contact me through Tawheed Wellness Chiropractic,
Okay.
10-644-4119, or online to healingdoc.com.
Okay.
Okay.
Did you guys, I hope you guys got that. That's watching, Miss Shamika.
TrueCareTelehealth.com. The number is 844-938-2828. I am Christ for Life, the NP, Gen X on TikTok, and Shamika Carter, NP on Facebook.
Okay. Miss Jamila.
And they can contact me on Facebook as Jamila Jones, or they can email me at jones.jamila@yahoo.com.
Awesome, awesome. And Miss Tina, let us know about Blue Activewear.
Blue Activewear. I own an activewear business, so I'm into fitness. I love activewear, so I like to, wear them all the time. So I got into that business 5 years ago. So you can catch me on Instagram at Blue Activewear 3. That's my Instagram, and then on Facebook it's just Tina Bluford. No, it's Blue Activewear.
Blue Activewear.
Yeah, it's Blue Activewear on Facebook. So I have many pages on Facebook for Blue Activewear. For Blue Activewear, I think I got like 3 of them, but they all mine, and they all still active. So anything you see Blue Activewear, and with Blue, people get it confused. They add an E. I don't have an E in my last name because it's named after me.
BLU?
BLU.
BLU.
Yes, correct. Yes. Some people don't have it correct. They always add that E. No, it's not. It's not Blue Ford. It's Blue Ford. So without the E.
Without the E, remember that.
Remember that.
Yes.
So you can catch me mostly all 3 of those on Facebook.
Yes. And we just want to close out. We have a couple of seconds. Again, we truly appreciate you guys being a part of this podcast. You guys are our second guest, so thank you guys for being a part of this podcast.
Yes.
Again, Dr. T, I know that you don't want to put too much attention to you, but I'm going to say this. We do appreciate you praying for our cousin, praying for Jamila's niece. We definitely appreciate that. Thank you for just being committed to what God has blessed you with. it is such an honor. So thank you so much.
Yes, we appreciate you being on here.
Miss Shamika, I want to say thank you as well for being a nurse practitioner in the healthcare. Thank you for just taking the time out to educate people and also being there for the elders. I am an elder person as well. I love to go give my recognition and also giving back to the seniors in the nursing home. I do that every year. So elderly people means a lot to me, just giving back to that community. So I really appreciate you. Jamila, thank you for being that wonderful CNA, working with the veterans, working at different facilities, different county hospitals. Thank you so much. Healthcare really does means a lot to me. So thank you guys.
Yes.
That's all I have to close with.
And I also would like to thank Dr. T, Shamika, and Jamila. You guys are awesome. Keep doing what you guys been doing. Just, just make everybody just feel good and help everybody. But yes, I appreciate you guys being on here. I thank you.
Thank you.
Thank
Because
you.
healthcare is important.
Very.
Like I said, I'm also a healthcare, and that means a lot to me. I started off working with the elders,
Yes.
and I've been working with elders off and on throughout my whole career, and it's a challenge,
Right.
but I do it because that's what's in me, is to help.
So we are going to end with our crown on. Crown on. Put
Thank
your
you,
hands like
everyone.
this, Dr. T.
Crown on. Thank you.
Okay. Thank you.
Okay.
Thanks.
Thanks.
Thank you very much.
Are you ready for it?
Take a look at our best sellers. This is always a hit. So is this.